Right, lecture 2 will start to look at universal design for learning, which we have mentioned before. As we'll discover, it's one of the issues associated with the assessment. We'll start thinking about what UDL is and how we can apply it to the assignment. So let's remind ourselves of the assignment. Your task is to critically analyse a public health campaign, otherwise known as an intervention, using two tools. PBDAC was briefly mentioned in Lecture 1, and we'll return to it later in the module, but for now we're going to focus on UDL, Universal Design for Learning. An example, a How Are You quiz. This NHS Public Health England quiz is designed to give you a free personalised health score. As usual, if you click on the image, it will open a link, and you can find the link also in the slide notes. This has been flagged up on Blackboard, and you should have completed the quiz before. We're not interested in individual results, but about how you thought, how easy it was, and how useful you think it is to yourself and other people. As usual, we'll discuss these concepts in tutorials. By the problem, I mean the problem that faces public health professionals and professionals in other related fields. Here, the How Are You survey has been widely used, but there's an open question about how effective it is as a tool. You can read the definition for health literacy here, skills, knowledge and confidence. A study by PHE, Public Health England, found that 42% of working age adults do not meet this standard. And if numeracy skills are required, that number goes up to 61%. I'll say right now, we view the problem as not being with people, but with interventions that do not effectively consider the issues that lead to limited health literacy. What we should be looking at is analysing the problems and developing solutions, and UDL is promising in this respect. Okay. Another issue is that many people in this country, English is not their first language, or they may have limited English skills. These data from the 2011 census for England and Wales. The next census is due in 2021, and although there may be changes in individual groups, there will still be a substantial proportion of the population for whom English is not their first language. In 2011, 7.7% of the population, 4.2 million people, had a main language other than English. So some factors. This is taken from the key messages section in the PHE report, which you should have a look at. Limited health literacy is linked to non-ideal lifestyle choices, which may be evidenced by factors such as poor diet and limited physical activity. We've talked in the past how difficult it is to join the dots on this, but this is a reasonable attempt at this. These non-ideal lifestyle choices are associated with a range of negative health outcomes. Note we don't say, as mentioned before, such choices cause negative health outcomes, just that they are associated with them. They are well established as being associated at population levels, but individuals are diverse, as we've discussed before. Some people may dodge the bullet, at least in the short or medium term. There's a term here, morbidity, which we'll define shortly, along with a useful link for definitions of public health terms. Social circumstances matter a lot. Increased income correlates strongly with better educational attainment, which is associated with better health outcomes. A key document in this area is Health Equity in England, often called the Marmot Review, after its lead author. You've been suggested that you should read the executive summary of this, and it's very highly recommended that you do. It provides key context for public health issues. We've recently had the second report, 10 years after the first version. Among other things, the report notes that improvements in life expectancy have stalled and declined for the 10% poorest of women. The health gap has grown between wealthy and deprived areas. And place matters. If you live in a deprived area of the North East, it's much worse for your health than living in a similarly deprived area in London. This is the PHE's suggested benefits for improving health literacy, and you can read them yourself. They are laudable, but they are focused on systems rather than individuals. What you're looking for in your assessment is how we can improve the effectiveness of interventions by ensuring they're accessible and understandable for people in many diverse groups. So here's the definitions of morbidity. I mentioned a little morbidity and morbidity rate, which I mentioned a little bit earlier on. These public health terms do keep coming up, so it's associated with having a disease or the presence of the disease in the population, and morbidity rate is a frequency or proportion of which a disease appears in a population. Here's the definition of mortality. The image here links to a resource with definitions of these terms. Mortality and morbidity will be discussed further by nutrition students in the second year life course and health module, and it will pop up in various contexts, as you can imagine. So, a potential solution. This is the basis of our thinking in this area. We apply the principles of UDL to the design of public health interventions. We started work on this as a students' as researchers project done by a very serious looking Heidi here, which we hopefully will get her and have a chat with you later. In this case, of course, you will use UDL to analyse interventions, which will also help you develop your knowledge for developing them. I've already seen the slide in Lecture 0. Hopefully you've looked at the 7 principles for universal design for living and the video, and we'll review the principles briefly next. So the 4 principles to the right, are perhaps most directly applicable to universal design for learning. An intervention should be available to all potential users in the target group, which may not be the whole population, of course. It should be simple to use, like the iCare instructions or the interfaces of many popular mobile phone apps. From our point of view, perceptible information refers to how well the design helps the user access information. Flexibility is one of the most difficult problems. Does the design of the app or the leaflet or whatever we're using accommodate a wide range of users' preferences and abilities? The other 3 principles are perhaps less directly applicable to universal design for learning, but we'll probably look at this issue again once we start to analyse interventions. This video, which we'll have a look at before we go further, is about UDL as it is applied to learning in universities. We already do this in our teaching. For example, a typical lecture is based around a presentation, which has the slide notes, a video recording, and probably a tutorial discussion. We can always do more, of course. Feel free to let us know. Okay, so I'll have a look at this video. I don't normally run videos from inside these video recordings of the lectures, but in this case I think it's probably worthwhile doing so.
Imagine you went into a big clothes store and all that was on sale was one type of outfit, in one size, with no thought given to different individual body shapes or personalities. That would be crazy, right? Expecting everyone to be able to fit into the same size and express themselves in the same colour and style? Yet in many cases, that's exactly what is happening in our education system. When it comes to learning, variability is the rule, not the exception, and our college campuses are now grappling with the demands of an increasingly diverse cohort of learners, with increasing numbers of international students, students from different cultural and socio-economic backgrounds, mature students, and students with disabilities. Despite this, curriculums are still designed for the mythical average learner, and all are expected to engage and learn on the same terms. Not enough flexibility is built in at the design stage to give all students equal opportunities to learn in ways that play to their own strengths. So, how can our institutions respond to these challenges? Enter Universal Design for Learning, or UDL for short. UDL is an educational framework that guides the design of learning goals, materials, methods and assessments, as well as the policies surrounding these curricular elements, with the diversity of learners in mind. The framework was developed by US organisation CAST and is based on research in the field of neuroscience. It promotes 3 core principles for educators to build into their teaching practice, calling on them to provide students with multiple means of engagement, representation, and action and expression. The framework includes a set of guidelines on how you can turn these principles into practice, For example, by fostering collaboration with the introduction of group work with clear goals, roles and responsibilities. By using different types of media to support learning and ensuring that all materials are accessible. And by providing a choice of assessment instruments while maintaining robust learning outcomes. You are probably already including some UDL elements in your practice without realising it, and there's much more to explore. So don't be afraid to let universal design for learning give you a new lens through which to look at your teaching and learning practice and help you to better reach all of your students. For more information and resources, visit ahead.ie/UDL.
Right, okay. Did that even work? I don't think it did. Can't possibly. Right, okay. Although that resource is mostly about teaching, many of the concepts which it uses are applicable to the sort of things we're interested in. As I think I've said to you before, we regard getting good nutritional information, health information out there as effectively being a learning process. Okay, so if you want to read more, this resource is from the Centre for Applied Special Technology, CAST at the Harvard Graduate School of Education, and it's a good source of information about UDL, mostly applied to teaching. There's a lot of material here which you can dip into if you're interested, although we'll be focusing on applying practical aspects of the issues we're interested in. A reminder of the principles we suggest are applicable to UDL. We can start to use these to develop a checklist to help us analyse public health interventions. As discussed, you should complete the HAIR questionnaire and start to think about this in terms of the UDL principles of equitability, flexibility, simplicity and perceivability. More of this in the tutorials, where we'll have start to introduce some tools and some concepts which will allow us to analyse public health interventions like HAIR. This is what we're doing. It's a reasonably novel approach. Okay, that's all for folks. Thanks for listening.